Well, welcome back. Now, you've probably heard that during the pandemic, rates of depression, suicide, and addiction are rising. We've reported on it several times. And while mental health experts try to navigate this ongoing crisis, there may be help on the way from drugs that are still considered some of the most dangerous in the world. CBS 58 investigates. Bill Walsh has more on the groundbreaking research being done right now.
The 1960s in America, revolutionary in many ways, including experimentation with psychedelic drugs. Dr. Timothy Leary, the face of this movement, he believes psychedelics could help people discover a higher level of consciousness. But Leary's research methods were questioned. LSD was blamed for accidents and psychosis, even death. President Nixon labeled Leary the most dangerous man in America, and in 1971, LSD and other psychedelics were labeled as Schedule I drugs, high potential for abuse, no accepted medical use.
It's taken decades to overcome that kind of stigma, and we still deal with it to some extent because they are so classified that way.
But times are changing. Dr. Alan Davis helped conduct a study just published by Johns Hopkins University. It used psilocybin, the active ingredient in magic mushrooms, to help treat depression.
This is done in the context of psychotherapy. So we spend about 8 hours of therapy with people prior to giving them psilocybin.
Participants in the study described losing hope after other treatments had failed.
Day to day, I really was not able to experience any sort of positive emotion.
Under medical supervision, people were given pharmaceutical-grade psilocybin. What was it like?
Sometimes there were representations and talking objects, talking animals. Sometimes things seemed like they were in a movie and I was watching them.
The results of this study have researchers surprised and excited.
1 week after the treatment was completed, about 67% of people had a clinically significant response, and 58% of people were in complete remission from depression.
That is 4 times more effective than any antidepressant drug currently on the market.
Post psilocybin, I am a lot more present. I am able to just appreciate things as they come.
What happens next is a larger study, and it's being coordinated by the USONA Institute just outside of Madison. So research that could revolutionize the way we treat depression, which kills tens of thousands every year, is happening right in our own backyard.
What USONA Institute is doing is not so different than what the vaccine makers are doing, which is you need to do a certain type of very rigorous study to show that the medicine works for the FDA to approve its use.
Charles Raison leads the research at the USONA Institute. He says one psilocybin treatment could replace a daily dose of current antidepressants.
The drug's out of the body in 3 to 4 hours, but people are reporting improvements lasting anywhere from months to years after that single dose.
Raison says the reason psilocybin treatments last is they alter your brain chemistry.
Most of the data suggests that acutely what they do is that they take the part of the brain that really is where the ego lives, where the sense of I lives, and they make it disintegrate a little bit. And when that happens, deeper, older parts of the brain get a chance for their voices to be heard.
This larger study will take about 2 years. If the results are the same as smaller scale studies, we could see psilocybin approved as a treatment soon after.
Based on the data to date, are the most transformational, astounding things that I have seen, or I think that many of us have seen, certainly for 40 or 50 years.
While the war on drugs set research back, attitudes are changing. Oregon just voted to legalize magic mushrooms for therapy, a lasting legacy of the revolutionary 1960s.
Yeah, the hippies were onto something, all right. Again, lots of mistakes and things that we do not want to see repeated. But there was a profound kernel of potential mental health treatment buried in amidst all that rock and roll craziness.
Psilocybin is also being looked at to treat anorexia and Alzheimer's, even quitting smoking. Similar studies are being conducted for LSD and MDMA, which is the active ingredient in ecstasy. Keep in mind, though, none of these drugs have been proven to work, and all of them are illegal to carry in Wisconsin, and they all carry large jail sentences. In Milwaukee, Bill Walsh, CBS 58 News.